Hello, everyone. I'm Coach Jimmy K with Denas Pain Relief Store here in Portland, Oregon. And we've got another video about real people, real results, about people using the Denas products. This is Dr. Raymond Solis from Houston, Texas. We're going to let him tell you about himself and his experience with Denas. Dr. Raymond, take it away.
Hey, Coach Jimmy, how are you?
Wonderful, wonderful.
Anyway, story is I got started. I enjoy reading an alternative complementary medicine gentleman named Dr. Mark Circus. He piqued my interest in about January of this year, talking about an article on electron medicine as the wave of the future. What got my interest about voltage potential, and especially with my wife now 3.5 years out with breast cancer, and how could you recharge the battery? How could you use that as a modality to treat, but also maybe after her treatment with surgery and chemotherapy, how can you help her mitochondria, her energy, her cells regain voltage potential, and also for long-term effects to help her health long-term. In addition, I have a grandson, and as you know, he's 2 years of age. The problem is when young infants have illnesses, it's very hard to give them medicines because of the side effects. So I thought, well, I need a modality, a handheld device that would also help my grandson. Any parent can do this. You don't have to be a doctor because, again, we're kind of restricted with medicines of side effects and things you can give them to help them recover from acute illnesses. So I started doing some research and came across many different devices. But the one thing I liked about yours when I found out was that for the price and the multi-functions and the pre-programs, it's not just a machine that can treat musculoskeletal, can treat so many different disorders, including one of the best benefits is helping people with sleep. So many people nowadays do not want to take medications for sleep and also have side effects. So that's an extra bonus. So that's how I got started, especially with looking at microcurrent therapy or the CNR devices or energy work.
Right. Excellent. Now, you're based in Houston, Texas. What's a little bit of background? Are you like an internal medicine? What type of medicine do you practice?
I'm internal medicine. I'm right outside of Houston in an area that's growing in Katy, Texas. I've been practicing internal medicine for 30 years. I've also been very interested in alternative complementary medicine for the past 30 years. I also do acupuncture for my patients. And so I've also had background in Tai Chi and Qigong and martial arts. And the other thing that's unique about your device is that it works along across the meridians in auricular therapy, and you have a probe and other devices. So it not only combines, pads, but basically locations that you can combine with other people that utilize things such as acupuncture and or meridians, energy work, shiatsu, Reiki therapy, all types of energy work modalities, and different people can use this machine.
This is just phenomenal. I mean, of course, several months ago, I met Dr. Solis, and he contacted me and told me about his wife, and he purchased the device and several attachments, and then started sharing it with his patients. And of course, he contacts me whenever he has a question, and he's kind of like on the hotline. I'll be talking to someone else on the phone, and I'll see him come up on caller ID, and I'll say, give me a few minutes. I've got to talk to the doctor. And they say, what do you mean? I said, I'll be right back. And then, of course, we can't count how many people you've helped with this device. Do you have any personal, as far as people, you want to tell us some of their stories?
I have a bunch of stories, but the most beautiful one is synchronicity today. I had a patient who's 52 years of age. I told her and her husband to probably buy this about 2 months ago, and they finally did it. And she told me today, spontaneously, coming in for a different reason. She came in just for a different condition. And at the conclusion, she says, thank you so much for helping me or telling me to get this device. I go, what do you mean? She's got scoliosis. She's had back surgeries and rods. She does not like medications. And basically, she used it the first night without even contacting you. And she basically was able to set it up. She got marked improvement. But the bonus was, without reading the manual, she says, you know what? I even slept excellent that night. And I'm going, well, there's more you can get out of it than that. So the whole point is that she basically is barely tapping into the potential. And not only that, with you, Jimmy, you have 24/7 availability, emails, contacts, and you get back very, very promptly with people. So she's all excited. So I've asked her to get back to you to emails for some bonus protocols specifically for her conditions.
All right. Excellent. Excellent. So, as far as any suggestions you have for other practitioners out there, of course, earlier you talked about Qigong and different things. We've got several massage therapists that have been coming on board, and chiropractors. Of course, this is a blessing that we're able to break over into modern day Western medicine with you. And I've got a couple of other doctors that I'm going to be doing interviews with. But any suggestions you have?
I think that this fits right into any approach, whether it is a medical professional, albeit a doctor, a nurse practitioner, physician's assistant, or a nurse, massage therapist, physical therapist. But the biggest thing, Coach Jimmy, is basically the patient becomes their own advocate. They can incorporate it to any modality, whether they are on medications, require medications, post-operative pain relief, any potential surgeries. I mean, you have to be cautious and careful, but you can, again, you don't have to be able to surgical site. You can be distant. You can wait 2 or 3 or 4 or 5 days. They can contact you. You can use the auricular modalities. You can use distant areas that map the location of the organ to help relieve pain. So I believe this is not just for healthcare professionals, yes, but I believe it's for everybody to have their own device at home. But let's go back to healthcare providers. You know, we're trying to help people with their pain, but healthcare providers, such as a massage therapist or any other person, can include that in their post-treatment. And whether they want to charge for it or do it as an extension, and they're going to gain more patients from that just by including in the protocol. In addition, personal trainers. I ran into one of my patients who happens to be a pediatrician. I told her to get it for her office work, but for her, she's got young kids. But her personal trainer, I said, you ought to get it because you're personally treating her, and you can combine this with her back therapy and whatever you want to do. So people can combine it in various ways.
That's awesome. Now, one thing that we've been working closely with you on several patients is pain.